Hi everyone, welcome to PharmaGrid. So today we are going to discuss some important multiple choice questions related to antibiotics. So whatever questions we are discussing through this video will be useful for any kind of pharmacy competitive exams. So the first question, the most likely causative organism in an acute uncomplicated urinary tract infection is, the options are E. coli, Staphylococcus aureus, Candida albicans, Staphylococcus epididymis, then Haemophilus influenza. So in the question they have asked us about the most likely causative organism in an acute uncomplicated UTI. So here the correct answer is option A, that is E. coli or Escherichia coli. Acute uncomplicated urinary infections are most commonly caused by Escherichia coli. Such infections are most common in women and are characterized by the presence of dysuria, urinary urgency, and suprapubic discomfort. So the next question, cross reactivity between penicillin and cephalosporins is. The options are 4 to 10%, 10 to 15%, 25 to 30%, 35 to 50%, 50 to 75%. Here the correct answer is option A, that is 4 to 10%. That is, the current data suggests that the cross reactivity between penicillin and cephalosporin is around 3% to 5%, and the highest rate of cross reactivity is between penicillin and first generation cephalosporins. Next one, a patient has a documented allergy to penicillin. Which of the following antibiotics should not be given to this patient due to the risk of cross reactivity? So in the previous question we have seen that the penicillin has cross reactivity with cephalosporins, that is about 3 to 5%, and the highest risk of cross reactivity is between penicillin and first generation cephalosporins. So among these options, ciprofloxacin is a fluoroquinolone antibiotic, azithromycin is a macrolide antibiotic, cefalexin is a first generation cephalosporin. Doxycycline belongs to tetracycline antibiotic. So here the correct answer is option C, which is a first generation cephalosporin, that is cefalexin. Antibiotic induced pseudomembranous colitis is most commonly treated with. The options are metronidazole, loperamide, clindamycin, gentamicin. So here the correct answer is option A, that is metronidazole. So the pseudomembranous colitis is a severe and occasionally fatal complication of antibiotic therapy. And the etiology of the pseudomembranous colitis is due to the presence of an exotoxin produced by the overgrowth of Clostridium difficile in the bowel. So the oral therapy with metronidazole 250 mg 4 times a day for 10 days is a recommended first line therapy. Vancomycin is also effective, but its use must be limited to decrease the development of vancomycin resistant organisms such as enterococci. And the vancomycin dose for the pseudomembranous colitis is 125 to 500 mg 4 times a day for 10 days. And this vancomycin should be limited to those who cannot tolerate or have not responded to metronidazole, or when metronidazole use is contraindicated, as in the first trimester of pregnancy. Which of the following drugs can be used as first line for the management of cystitis? The options are nitrofurantoin, doxycycline, amoxicillin, moxifloxacin, clindamycin. So cystitis is the inflammation of the bladder usually caused by a bladder infection. It's a common type of urinary tract infection, particularly in women. So here the correct answer is option A, that is nitrofurantoin. That is, nitrofurantoin can be used as the first line for the management of cystitis. An advantage of amoxicillin over ampicillin is that it is more acid stable, it is not destroyed by penicillinase, has a broader spectrum, does not cause allergies, has a longer shelf life. So in the question they have asked us to find out the advantage of amoxicillin over ampicillin. So both this amoxicillin and ampicillin are aminopenicillins belong to extended spectrum penicillins. So here the correct answer is option A, that is, the only advantage is that amoxicillin is not easily destroyed by the stomach acid. Which penicillin is effective in the presence of penicillinase? The options are amoxicillin, flucloxacillin, phenoxymethyl penicillin, ticarcillin. Here the correct answer is option B, that is flucloxacillin, and examples for other penicillinase resistant penicillins include methicillin, cloxacillin, and dicloxacillin. Telithromycin is a member of which class of anti-infectives? The options are cephalosporin, penicillin, aminoglycoside, ketolide, sulfonamide. Here the correct answer is option D, that is ketolide. This telithromycin is a ketolide antibiotic indicated for the treatment of acute bronchitis, sinusitis, and community-acquired pneumonia. Which of the following statements are true for tetracyclines? The options are: they may cause yellowing of the teeth in adolescents, they are bacteriostatic, they exhibit a broad spectrum of activity. So here the correct answer is option A, that is all these three statements are true for tetracyclines. The principal mechanism of action of penicillins on microorganisms is, the options are inhibition of cell wall synthesis, destruction of the nucleus, bacteriostatic, causing mutations, lysis. Here the correct answer is option A, that is penicillins act primarily by the inhibition of cell wall synthesis in susceptible microorganisms and are bactericidal in nature. Linezolid is used against infections caused by antibiotic resistant. The options are gram-positive cocci, gram-negative bacilli, HIV virus, gram-negative cocci, none of the above. Here the correct answer is option A, that is gram-positive cocci. This linezolid is an oxazolidinone antibiotic used to treat infections by susceptible strains of aerobic gram-positive bacteria. And this drug was FDA approved in 2000 for the treatment of vancomycin-resistant Enterococcus faecium infection and nosocomial pneumonia caused by Staphylococcus aureus, including MRSA or Streptococcus pneumonia. Gentamicin exhibits, the options are significant hepatotoxicity, significant cardiotoxicity, significant dermal toxicity, significant nephrotoxicity, all of the above. Here the correct answer is option D, that is significant nephrotoxicity. Gentamicin is noted for nephrotoxicity as it is true of other aminoglycoside antibiotics. Which of the following substances is used in combination with beta-lactam antibiotics to extend their spectrum of activity? The options are cilastatin, sulbactam, tazobactam, clavulanic acid, all of the above. Here, the correct answer is option E, that is all these substances are used to extend spectrums. Specific combinations include imipenem cilastatin, piperacillin tazobactam, ampicillin sulbactam, and amoxicillin clavulanic acid. In young children, tetracyclines often cause, the options are granulocytosis, discoloration of teeth, conjunctivitis, muscular weakness, hyperplasia of the gums. So here the answer will be option B, that is discoloration of the teeth. This is an irreversible discoloration that occurs during the tooth forming years. Isoniazid is very active against, the options are streptococci, staphylococci, mycobacteria, vibrio, resistant staphylococci. Here the correct answer is option C, that is isoniazid has little activity against all but mycobacteria. It is particularly effective against Mycobacterium tuberculosis. Primary or secondary syphilis in adults should be treated with a single dose of. The options are benzathine penicillin G 2.4 million units intramuscularly, ciprofloxacin 500 mg per oral, acyclovir 800 mg per oral, A and B, none of the above. Here the correct answer is option A, that is benzathine penicillin G 2.4 million units intramuscularly. Parenteral penicillin G is effective in achieving local cure and preventing later complications in most individuals with primary or secondary syphilis and is recommended by the Centers for Disease Control and Prevention, that is the CDC. For patients allergic to penicillin, 2 weeks of oral doxycycline or tetracycline is recommended. Lyme disease is caused by which of the following organisms? The options are Shigella species, Enterobacter aerogenes, Borrelia burgdorferi, Listeria monocytogenes, none of the above. Here the correct answer is option C, that is Borrelia burgdorferi. A spirochete is the cause of Lyme disease. Histologic staining is often difficult because affected tissues may not contain a large number of spirochetes and the organism is not grown easily in the laboratory. Initial empiric treatment of tuberculosis in an adult should include which of the following drugs? The options are isoniazid, rifampin, pyrazinamide, ethambutol, all of the above. Here the correct answer is option E. The CDC recommends that a 4-drug regimen with isoniazid, rifampin, pyrazinamide and streptomycin or ethambutol is a preferred initial and empiric treatment for tuberculosis in children and adults. The recommended single-dose regimen for non-gonococcal urethritis is, the options are penicillin, azithromycin, cefalexin, metronidazole, linezolid. Here the answer is option B, that is azithromycin. Azithromycin is a macrolide antibiotic. Azithromycin 1 gram orally in a single dose or doxycycline 100 mg orally twice a day for 7 days are the recommended regimens for the treatment of non-gonococcal urethritis. A 24-year-old pregnant woman presents to the urgent care clinic with fever and urinary frequency and urgency. She is diagnosed with a urinary tract infection. Based on potential harm to the fetus, which of the following medications should be avoided in treating her UTI? The options are nitrofurantoin, amoxicillin, cefalexin, doxycycline. So in the question, They have asked us to find out the medication that should be avoided in treating her UTI because she is pregnant. So here the correct answer is option D, that is doxycycline. Doxycycline, it is a tetracycline. It should be avoided due to the potential harm to the fetus. Nitrofurantoin, amoxicillin and cephalexin are generally considered safe in pregnancy. Which of the following agents is considered a narrow spectrum antibiotic? The options are ceftriaxone, ciprofloxacin, isoniazid, imipenem. So here the correct answer is option C, that is isoniazid, because in the question they have asked us to find out the narrow spectrum antibiotic. So here the correct answer is option C, that is isoniazid. Remaining all others are broad spectrum antibiotics. Isoniazid is only active against Mycobacterium tuberculosis, while ceftriaxone, ciprofloxacin and imipenem are considered broad spectrum due to their activity against multiple types of bacteria and increased risk for contributing to the development of a superinfection. Which of the following antibiotics exhibits concentration-dependent killing? The options are clindamycin, linezolid, vancomycin, daptomycin. Here the correct answer is option D, that is daptomycin. Clindamycin, linezolid and vancomycin exhibit time-dependent killing, while daptomycin works best when administered in a fashion that optimizes concentration-dependent killing. Which of the following antibiotics exhibits a long post-antibiotic effect that permits once daily dosing? The options are gentamicin, penicillin G, vancomycin, aztreonam. So post-antibiotic effect means it's the persistent suppression of microbial growth that occurs after levels of antibiotic have fallen below the MIC. MIC is the minimum inhibitory concentration. And the drugs or the antibiotics that exhibit long post-antibiotic effect includes aminoglycosides and fluoroquinolones. So here the correct answer is option A, gentamicin. Aminoglycosides including gentamicin possesses a long post-antibiotic effect, especially when given as a high dose every 24 hours. Penicillin G, clindamycin and vancomycin have a relatively short post-antibiotic effect and require dosing that maintains concentrations above the MIC for a longer portion of the dosing interval. A 72-year-old male presents with fever, cough, malaise and shortness of breath. His chest X-ray shows bilateral infiltrates consistent with pneumonia. Bronchial wash cultures reveal Pseudomonas aeruginosa sensitive to cefepime. Which of the following is the best dosing scheme for cefepime based on the drug's time-dependent bactericidal activity? The options are 1 gram every 6 hours given over 30 minutes, 2 gram every 12 hours given over 3 hours, 4 gram every 24 hours given over 30 minutes, 4 gram given as continuous infusion over 24 hours. Here the correct answer is option D, that is cefepime follows time-dependent bactericidal activity. The clinical efficacy of cefepime is based on the percentage of time that the drug concentration remains above the minimum inhibitory concentration, which is the MIC. A continuous infusion would allow for the greatest amount of time above the MIC compared to intermittent. Intermittent means 30 minutes and prolonged infusions, that is 3 to 4 hours of infusion. Which of the following adverse effects is associated with the daptomycin? The options are ototoxicity, Redman syndrome, QT prolongation, rhabdomyolysis. Here the correct answer is option D, that is rhabdomyolysis. This ototoxicity and Redman syndrome are associated with the vancomycin among these antibiotics. Then QT prolongation is associated with the telavancin, which is also an antibiotic. Then myalgias and rhabdomyolysis have been reported with the daptomycin therapy and require patient education monitoring. So with this question, we have completed today's question discussion series. Thank you everyone for watching this video. Please like, share and subscribe. Have a nice day.